important. Yeah. Okay. So let's talk about ultrasound. So I'm sure one of the things you love to talk about. So what's so great about ultrasound when it comes to talking about this stuff?
Yeah. So what's fun is that one, it could be dynamic. I can actually see the tendon move. I can have, okay, let's take a knee, because the patella tendons are really easy tendon to see on ultrasound. And you can actually see that thickening on the deep side of that tendon, where it's going towards the fat pad, Hoffa's fat pad, and right at the insertion at the kneecap or the patella. And you can see that thickening in those changes on there. You can see, and again, there's a setting that you can turn on to see the blood vessels, and and I call them stars because they flicker like stars. Little red dots within that swollen area where there's neovascularity. And you can compare it to the other one without having to order another MRI. You can compare it to the other one very quickly in the clinic, and you can measure the thickness of that tendon and go, yep, there it is, clear as day. That's a way that you can see it, and you can appreciate it a little bit more. You can sometimes see, depending on the severity of it, you can see partial tears and with the changes of the tendon of it. It's just a nice guide you can utilize for a quick evaluation there in the clinic. It does not take long to evaluate them.
And it doesn't hurt.
Doesn't hurt. In fact, they get a little moisturizer because the gel has a little aloe base.
So I was listening to one of the lectures you sent over to me last night, and the presenter mentioned something called microanatomy, which I'd never really heard before, but it makes a lot of sense because there's gross anatomy, I guess, where you can see it's just a tendon. You just see a big, thick cord of something. But there's actual important smaller bits of that anatomy that you can actually see on the ultrasound, the fibers and things like that, the fiber orientation. And you can even see that disorganization of those fibers that we talked about earlier, right?
Yeah.
Okay.
Yeah. So again, it goes down to the cellular level that we're working on.
And you don't always see it. You can see a little bit maybe on an MRI, but not like that super fine detail.
Not that detail, not to that magnitude, I guess, especially on really good ultrasound machines. It's like it can get some detail.
Perfect. So ultrasound, you can get all that nice detail. You can actually see the tendon move, which is really cool. Patients like it. They can watch it at the same time. And then in terms of like treatment, you even use it with treatment, right?
I can.
Yeah.
So let's talk about it. I mean, with ultrasound, we can use various different types of injections.
Right. And so when you use ultrasound with that, what you're doing is you can find that precise anatomy with the ultrasound. And with 100% precision, actually, and I use this term.
Watch it.
Right. With 100% precision, you can put the medication exactly where you want it.
Yeah, exactly. Because I can
Hugely
watch that
beneficial.
needle. And I can watch that needle go right to the problem.
So if I see patients, they come to see me, maybe they've seen somebody else, and they've had an injection, and that's helpful to know. But what's even more helpful is where was it given, and if it was done under ultrasound, then I have a little bit more confidence, maybe a lot more confidence that the shot actually went to the intended target. Because if my shoulder hurts here and I had a shot that was done by feel, okay, some people are good, but an honest person is probably going to say, I probably have a miss rate. And they had no response to the injection, bathing the area with a local numbing medicine. And they don't get any better, even for like a brief period of time. You're like, okay,
clearly that's not the problem.
They're not right. They're not hurting here. So the ultrasound, I think, is just a great way of doing things.
It's again, it's an easy tool to be able to ensure needle placement, and I just with the years as it's advanced, it's just gotten a little bit easier and easier to utilize that tool.